what can I do to help my own health? And that has now evolved into longevity medicine, because hormones are very foundational with longevity medicine. I don't want to call it the fountain of youth, but they are very important to slow down the aging process, to give us energy, keep our cells vital and functioning properly. And so that's where I am today. Hi, welcome to the ChristiMD podcast. I'm so glad you're here. And I thought today it would be a good idea to just take a step back and talk about what is urology and what was my journey to urology and then ultimately to urogynecology and longevity medicine. So I'm so glad you're here, and I hope you'll subscribe to the podcast and click the bell so you'll get alerted when there's a new episode. All right, so my name is Dr. Christi, and this is about my journey through medicine. So I'm going to start at the very beginning. I'm one of those lucky people that have had a calling on my life since I was the age of 3 years old. I always knew that I wanted to be a doctor. I don't know where exactly that came from, but I just had this feeling in my heart that I just wanted to be able to help people the best way that I could. I've always loved studying. I always loved school and learning came easy to me. So I was able to excel in school. I had the aptitude to go into medicine. I also always loved working with my hands. I loved doing crafts and electrician kits that you'd get from RCA or chemistry kits. I loved crocheting and cross-stitching and sewing and art. So it kind of is ironic that I ended up in a field that incorporates both book knowledge and using your hands. So I always knew that I wanted to go into medicine. I had a couple of little funny little side thoughts along the way. One was that I wanted to be a veterinarian. I'm going to grab something really quick. Okay, so this is something that I wrote when I was in the third grade in a class called Ringlish. I guess it was writing and English together. This is May 8th, 1978. And my mother kept this and framed it for me, which was so sweet. That was just so precious that she did that. So when I graduated from medical school, she gave me this. But this is what I wrote. I wrote, my future. When I'm grown up, I'm going to be a veterinarian. So at this point, I thought maybe I'll be a veterinarian. I just love animals. They're all so cute and cuddly. I know I'd love my job very much. I'd also get good pay. I'd do all kinds of surgery. I would cure all kinds of diseases. I would give out 1 million prescriptions a week. I might even have to put a pacemaker in a parrot. Before I got married, I would be known as Dr. Klein, big capital letters. So I was just always enamored with the thought of being a doctor and just thought it would be really enjoyable and satisfying. And so I just kept focused on that goal throughout my education. So came time to go to college, and I was in Atlanta growing up at that time, and was encouraged to apply to Georgia Tech by a friend. So I did. It wasn't necessarily my first choice because it really didn't have a strong pre-med program. But I ended up getting a scholarship to Georgia Tech, an academic scholarship. And that became the best choice, financially. How can you turn down free college at a great school? So I ended up going to Georgia Tech and ended up studying chemical engineering pre-med. I sort of picked chemical engineering because I liked chemistry and math. I didn't really want to do just biology for some reason. Now I think it would have been really fun and fascinating. But I kind of thought in the back of my mind, well, if medicine doesn't work out, then chemical engineering would be a good fallback plan. Not really recognizing at the time that they're really different fields, different type of brain alignment to do those different kinds of disciplines. So I did chemical engineering. I graduated with honors. I never really loved it. I liked parts of it. Some of the classes were pretty cool. I resonated most with the mechanical engineering classes. I thought those were really, really fun. But I did end up graduating on time with honors and got into med school and was able to pursue my dream to be a doctor. I went to med school in Birmingham, Alabama at UAB, the University of Alabama at Birmingham. And it was an excellent medical school. The Harrison's Annals of Internal Medicine came out of Birmingham. Dr. Harrison was a professor there. They had a very renowned surgery program and cardiovascular program. The obstetrics and gynecology program was amazing, as well as the gyn oncology. And there were just several really wonderful departments in Birmingham, Alabama, of all places. You know, I had not lived in a city that was smaller. And, but I was very pleased with my education there. I met some amazing people along the way and really enjoyed my time in Birmingham. I was in gross anatomy the very first semester of medical school. And this may sound kind of strange, but we were dissecting the cadaver. So you would dissect, someone would donate their body to science, and we would be able to dissect their body and learn anatomy up close and personal. And I really enjoyed that. I really enjoyed using my hands, using the knife, and began to think, okay, what kind of doctor do I want to be? I think I might want to go into surgery. And this was in the early 90s. There were more women going into surgery and subspecialty surgery, a lot more women going into obstetrics and gynecology at that time. So it seemed a little bit like a reach, but it didn't seem out of reach completely. So I decided to start thinking about that. I kind of went back and forth in my 4 years of med school. I did a year of research, actually in cancer research using immunotherapy on a Howard Hughes research fellowship. That was really fun and interesting. That was a really impactful year in my life. I realized I didn't really want to do bench research for a career. But I did learn a lot. I met a lot of great people and was able to present my research around the country. So that was pretty cool. So I get to my senior year, and now I've got to make a decision about what am I going to do. And what you do in med school is your fourth year, you apply to a specialty. So you have to kind of nail down a specialty at the beginning of your senior year. You've had 2 years of, the way it was at my med school, we did 2 years of basic science in the classroom. And then you do 2 years of clinical rotations where you're going through the different specialties, and you do pediatrics, internal medicine, general surgery, and then you do some of the OBGYN, and then you can do subspecialty electives. And you can kind of get a taste of each thing. You learn about each thing, so you have some proficiency in it, and then you get a taste to see what do you feel like would fit for you. So at that point, the beginning of my senior year of med school, I was really thinking obstetrics and gynecology because it involves surgery, but it didn't seem as crazy difficult as doing one of the general surgeries or general surgery specialties. And I didn't really want to deliver babies. I had done that in my rotation. It didn't resonate with me. I thought it was cool, but it didn't light my fire. So I thought I would do gynecologic oncology and remove uterine cancer, cervical cancer, ovarian cancer, really big, cool surgeries and good medicine. And really, the people that were there were incredible mentors. So I'm all ready to apply for that. And then I did a rotation in urology, a 2-week rotation. I just fell in love with it right away. I was like, this is the coolest specialty there is. The people, the urologists, were really fun. They were really down to earth, kind of a little more on the laid back, but the smart, ambitious side, not too intense. Good sense of humor. You have to have a good sense of humor to go into urology and deal with genitalia and help people feel comfortable. And then just really cool technologies. And I began to see, like, okay, in urology, I can treat men and women. I can treat adults and children. I can do big cancer surgeries, and I can do tiny microscopic surgery, vasectomy reversals. So it just had a big range of cool stuff. Plus, there's a lot of patients in urology that you don't never operate on. You're just seeing them in the office and helping them solve their urological problem. So for many reasons, it appealed to me and looked really interesting. But it was the 11th hour. I had only done 2 weeks of this. I had my application ready for OBGYN to apply to all these residencies across the country. I had picked out the top 10 that I was interested in, from Pittsburgh all the way out to Stanford. At the very last minute, I changed my mind. I just decided, you know what? I'm going to go for it. I just feel like this is something that I would enjoy. And it seems kind of crazy. There weren't very many women in urology at all at that time, maybe a few dozen across the country. So I went for it, and I interviewed across the country, and I ended up matching at one of the top 3 programs in the nation, which was Baylor College of Medicine here in Houston, Texas. And it was perfect because I was born in Texas, and I had always kind of wanted to come back to Texas. It just felt like home to me. So to be able to come back to Texas and do my training here, it just felt like, okay, this is all making sense. So I came to Houston and did a urology residency. And I have to tell you, I don't know how anybody could have a better urological training than what I had. Baylor at that time, it incorporated, well, number one, Texas Medical Center is the biggest medical center in the world. There's so many hospitals just concentrated in Houston, in this small area. And my residency incorporated almost all of those hospitals. We went to St. Luke's, Methodist, those are private hospitals. We did Ben Taub, which was the general public hospital where we would have trauma and gunshot wounds. We had Texas Children's Hospital, the largest children's hospital in the world. And we had the Veterans Administration, the VA hospital, which has, a whole range of urological and patients that are struggling with all kinds of different things. So, and we learned everything. We learned the biggest surgeries that there are in urology, removing the bladder, reconstructing, making a new bladder, removing all the lymph nodes, removing big giant kidney tumors that are invading into the blood vessels, the great blood vessels of the like the inferior vena cava, all the way down to microscopic. I mean, we trained with world-renowned Dr. Lipschultz, who does microscopic vasectomy reversal. So we did all that. We would do gunshot wounds. We'd be on trauma call, and we'd have gunshot wounds to the kidney, the penis, the scrotum, the vagina, all of that. It was incredible. I had the most broad, amazing experience. Many world-renowned urologists that I worked with. So super proud of that, if you can't tell. And did a year of research. That was part of our program. It was a 6-year training program. So I was in school and training all the way up until I was 35 years old. No, that's not right. Up until I was 33 years old. I was getting ready for my career, but I loved every minute of it. It was not even like, I didn't feel like I was waiting. I was just embracing each moment as it came. So I did all this wonderful training, and then considered a fellowship to be more specialized, but I was getting ready to kind of start my family and thought, I don't want to move around. I'm just want to get going here in Houston. And I joined a really great group, an incredible group of urologists in Houston, a private practice. And then it was interesting because my practice became almost immediately all female. I mean, I was really kind of annoyed at first because I did so much training with men and helping them with their prostates and erectile penile implants, whatever men needed, I could do. But as soon as the women heard that there was a female urologist in West Houston, they just, I got the referrals and my books just filled up really quickly with women. And after a couple years, I just decided, you know what, I'm going to embrace it. I enjoy this a lot, and I think it's exciting. So I'm going to go for it. I'm going to embrace it. And I've never looked back. I've continued on with my training with women, like really delving into women's sexual health, intimate health, going to conferences for that, helping women with incontinence, developing new skills such as the robotic bladder lift. That's something that I picked up along the way in private practice. And that has now evolved even further, where I have board certification in Urogynecology, also known as female pelvic medicine and reconstructive surgery. And I think there's a new name for it now. They keep kind of revising it to make it a little more reflective of what we do from day to day. So now I've got that. So I do urology and urogynecology. And then a few years back, I started really looking into hormones and bioidentical hormones. How can I bring that to my patients and bring that to myself too? As I'm aging and going through menopause, I went through very early menopause. What can I do to help my own health? And that has now evolved into longevity medicine, because hormones are very foundational with longevity medicine. I don't want to call it the fountain of youth, but they are very important to slow down the aging process, to give us energy, keep our cells vital and functioning properly. And so that's where I am today. I'm not just hormones, but nutrients, looking at functional medicine, and how I can help patients, the whole picture, not just their urological care, because a lot of times the urological problem is part of a bigger issue going on with their metabolism, their immune system, their ability to process what's going on with their environment. And so now I'm kind of bringing that all together, and also improving intimate health, which I think is just so critical to good health and to good life. So that's where I am. And urology is an exciting field. I encourage every medical student that I have a chance to look into urology and consider it, because it is very fun. We do really cool stuff with technology and surgeries. And we get to develop relationships with our patients. So it's not just you meet them, you fix them, and then you take out an organ and then they move on. That does happen occasionally, but usually you get to develop a relationship, which is very satisfying as a physician. So that's about me. That's about urology and my journey. I'd love to hear any questions that you have, and look forward to seeing you again. Bye.